The health department says if more people are vaccinated, the fourth wave will have less of an impact. Let's discuss this with Dr. Somaroo from Wits School of Public Health to tell us a bit more. Doc, I think South Africans really need to hear this from somebody who's a specialist in public health. How is South Africa looking in terms of this fourth wave? Is it looming?
Hi, good morning. Yes, I think current predictions expect that the fourth wave will probably occur towards the end of December or early January. So as much as we don't expect the fourth wave to be as intense as the third wave, we do expect this to occur, and we want to prepare in advance, and we want to really reduce the impact of it, which is why the focus really is on increasing vaccination coverage, and hopefully the Vuma weekend will contribute to achieving this.
Of course, the Vuma weekend the last time was pretty much successful in terms of getting people to go get their jabs. Then we saw younger people coming on, and it looked like they encouraged the older people to go there. How are we looking right now in terms of people, stopping listening to, the conspiracy theories that are out there?
So, I think from our current understanding, there's various reasons that people don't vaccinate. One is access to the vaccination, and this is why the different provinces, including Gauteng, are really going out of their way to increase access and to bring vaccination sites closer to people. The second thing is misinformation. And so here as well, I think there's been a lot of attempts made to correct these misperceptions. Unfortunately, I think a lot of people may not have easy access to a lot of information channels, but here as well, as we're taking the vaccination campaigns closer to people's homes, I think the correct information is being taken as well. And so hopefully people will, their fears will be allayed, and they will they will agree to take the vaccination.
And of course, looking at, for instance, political parties such as the ACDP and other organizations saying that they're going to take government to court for giving the jab to children between 12 and 17, does that also not make us track back, or are they, are they onto something by taking government to court?
No, I mean, I really think this is counterproductive at this time. Obviously, people do have differing opinions, but I would think that it would be better for them to engage with government and government's experts before actually taking this to court and creating more confusion amongst the public. At this present time, from our current understanding, I mean, these are good decisions that have been made. It's not a risk factor to vaccinate the younger people. People may have differing opinions about the current strategy, but in terms of the ACDP court case, I really don't think it's merited.
Doc, looking at the kind of work that Wits University and other universities have done in the past 2 years, along with the department and vaccinations, do you think South Africa does have a chance of reaching that herd immunity? Although it's been taken down from 70%, we know, but are we looking good in terms of the fight against the fourth wave?
Well, no, unfortunately, current predictions, well, it's very unlikely that South Africa will reach a position of herd immunity, especially before the fourth wave and with this vaccination rollout. However, there has been increasing vaccination coverage, I think, especially amongst the high-risk groups. At the moment, we're sitting at over 60%. So that is very promising. And even if we don't reach herd immunity, which was the original goal, the vaccination coverage and the increase in vaccination coverage is still going to hold us in good stead in terms of decreasing the impact of the first wave. And I think the one thing I'd like to say is that people should remember when they're taking the COVID vaccination, they're firstly protecting themselves. These vaccinations have all been shown to decrease severe illness. So even though somebody may still get infected, the severity is going to be less, and it's really going to decrease the chances that they will need hospitalization, and it's going to decrease their risk of death to almost 0%. And that is very important for people to consider when they're making the decision to vaccinate. And secondly, when they vaccinate, they're protecting those around them. So because they will be protected, the risk of infection is less, so the risk of transmitting infection to others will be less as well. So it's really twofold. And even if we don't reach this golden number of percentage that we require for herd immunity, the more people who are vaccinated, the more impact we're going to have. So even though the government has set the target at 70% of over 60-year-olds for now, I think we should aim for higher than that, because every extra person who's vaccinated will result in a decrease in the impact of the potential fourth wave.